stands for progressive and regressive angular isometric loading. That doesn't matter. All you need to know is that PAILS and rails is a methodology that uses isometric muscle contraction as well as time under tension to not only improve your flexibility, but increase your strength through a range of motion, which is what mobility stands for. So this exercise is going to be a sequence of stretches in a position and contractions into and out of that position while trying to only further your stretch into it. So we're going to start with internal rotation and hip rotation, and that is going to be the back leg in this 90-90 position. So both legs are at a 90-degree angle with heel, knee, heel in line. The biggest thing you're looking for when you do this is closing angle joint pain. None of this should be painful. You will probably feel some discomfort. However, the most important area of pain that you should avoid is the inside of the groin here. Closing angle joint pain means that if you are moving toward a direction in a joint, you shouldn't feel any pain or pinching in that direction. That means tissue, something could be pinched in there, and you could potentially damage it if you push into it. So, since we are internally rotating our hip socket here, we want to make sure that we're not getting any pinching on the inside. What you should feel is some tension in kind of a C shape around the back of the leg, potentially some stretching here on the outside, but just make sure you're not getting any pinching in the groin. If you are in this position, what you can do is lean away from it, and what that does is that decreases kind of the congestion here. So lean away from it, but keep a nice long spine. So however you need to support yourself with your hands is fine until you can feel that stretch here. So as you lean back, or if you can sit up and feel comfortable in it, I need to lean back a little bit, but you are working this hip down towards the floor. So as you sit here, you're trying to get that hip down that way. That puts you further into the stretch. So I want you to get to a point where you can kind of feel it and you feel some tension around here. Once you get that, what I'm going to have you do is come out of it, and I'm going to have you lift your leg up off the floor. So knee stays planted, and just your foot lifts up off the floor. Make sure that you're not hiking your hip up. Okay, we want to really isolate this muscle here and lift that up off the floor. Okay, and then you're going to try and maintain that as you sit back. And when you can no longer keep that lifted up off the floor as you push that hip back down into there, you're going to relax. This is where we're going to start our stretch, okay? So the sequence is a 2-minute stretch, a 15-second push away from the stretch, so you're going to push down into the floor, and then you're going to pull yourself deeper into the floor by trying to lift your foot off the floor, but not rolling out of it, and then you're going to try and drive deeper into it. So I'll explain that a little bit better here in a second. Right now we're just hanging out in this position. You may not feel a lot of tension yet, and that's okay, but we're at that end range that you could control, right? If you couldn't lift your foot up off the floor anymore. So while we hang out here, we want to take some nice easy breaths. In through your nose, out through your mouth, just kind of let everything fall into place. And from here, if you feel like you could go a little deeper into the stretch, you can. Just make sure you're not getting too much tension, especially to start. Maintain that nice long spine. So before we start to push, don't do it yet, I'm going to give you a few things to think about. The first thing I want you to do is to punch this arm out. Make a fist, make that tight. Then I want you to bring some air into that belly. Create a little bit of tension there. You're still breathing though, nice and easy. And that's going to create tension through the body and just bring a little bit more intensity to this movement. Okay, so a couple more breaths here. You're just nice and relaxed. Everything is kind of sinking down, getting comfortable in this position. So not yet, but when I say go, the first thing you're going to do is start to drive down the floor away from you with your knee. You're going to do 1 pound at a time. Don't do it yet. Then you're going to move down to the ankle. So your whole shin is going to be driving the floor away from you. Nothing else has moved. Actually, nothing has moved. Don't do anything yet. But you're starting to try and push the floor away from you. Then you're going to start to drive down with the whole leg. You should start to feel that on the inside of the leg here, underneath. Your core starts to tighten up. You're punching that hand out. Don't do it yet. You're just relaxed. Okay? And then you're going to work up 1 pound at a time, 2 pounds, 3, 4, until you reach about about 80% of your max capacity or any kind of pain. Make sure you pay attention to that closing eagle joint pain. This inside muscle working is different than pinching, okay? So be aware of that. Once you get to about 80 to 90% of your max capacity, we're gonna hold. We're gonna hold for about 10 to 15 seconds. You won't know, I'm gonna count it down, but it's gonna be about that time. After that, you're gonna relax and you're gonna try and lift that foot off the floor. I don't want you to roll out of this though. I want you to keep this positioning as you try and lift that foot up off the floor. If you can lift that foot up off the floor, then I'm gonna have you hold it. We're gonna hold it for 10 seconds, and then I'm gonna have you come down, push that hip down until you can no longer lift your foot up off the floor. And then we're gonna repeat that. So we're gonna do a 2-minute stretch. It's a 15-second contraction down away from the stretch and a 10-second contraction further into your stretch, okay? So now we're gonna go. So I'm gonna have you punch this hand out, sit up nice and tall, pack some air in here. You're gonna slowly start to drive the floor down away from you with your knee. So you're pushing your knee into the floor, 1 pound. Move down to the ankle, 2 pounds. Your whole shin is driving down, 3 pounds. The whole leg is starting to drive down away from you. Notice nothing has moved, right? You're just starting to feel this work. 3 pounds, 4, 5, 6, keep driving down, 7, the more of the leg is working, hand is punched out, 2, and 8, and hold. Okay, so you're about 80% of your max capacity now. Everything is driving down, core is tight, hands punched out. Take another deep breath, maintain that tension. Maintain. 1 more deep breath, 3, 2, 1. Now I want you to try and pull this foot up off the floor. This hip isn't gonna move. Don't lift that up off the floor. You're just gonna try and lift that foot up. You should feel this working. If you start to cramp, I don't want you to move. I want you to maybe relax, but breathe through it. Cramping is just neurological confusion. Keep trying to pull that foot up off the floor. 2, 1, and now if that foot came up, I want you to sit that hip down until your foot comes off, or until your foot sits on the floor, and then you're going to relax. Take a breath. If it didn't, I want you to just push that hip down just a little bit until you feel a little more tension. Now completely relax. Take a breath. Don't come out of it. You're just gonna sit here. So cramping, neurological confusion, right? Your body is not used to working at this super shortened or lengthened range. In this case, it's shortened, but lengthened can happen too. So the more you make your body work there and be comfortable in that position, the less cramping will happen. If you continuously come out of it, you're basically telling your body that, oh, it's okay, we don't need to work here, okay? So always try to just breathe through it. The more you breathe through it, the less it will happen. I promise. It'll get better, okay? So if you're cramping right now, I want you to just breathe. You can massage it a little bit. Try not to come out of it, okay? So now we're going to do another 2 minutes. We're going to do 2 rounds here. I want you to start with 2 rounds. Ultimately, I want you to be able to do 3 rounds, okay, at 100%. And so 1 round equals 2 minutes stretch, a 15-second contraction, a 10-second regressive contraction, and that's 1 round, okay? So then another one, right? This is the next 2 minutes. This is round 2. We're going to do 2 rounds. Ultimately, I want you to do 3, in which if you need talking through it, you can just rewind the video and go back through it. We're just going to do 2. So from here, we've been here about 1.5 minutes. I'm just kind of talking you through it. It's much better that way. So we're going to do it again. The first thing I want you to do is sit up nice and tall. You should always maintain your posture. That's very important. Take a breath, nice and easy. Remember to breathe. Then you're going to punch this hand out. Make a fist. You're going to crush that here. Starts to get tight all through the body, right? Take a breath in, pack some air in here, sit up tall, okay? You're gonna hold this. Now you're gonna start to drive your knee down into the floor. Drive your floor away from you, 1 pound. Now you're gonna move down to the ankle. Now your whole shin is pushing away from you, 2 pounds. Nothing has moved, right? 3 pounds, your whole leg is driving the floor down away from you. You should feel this all working on the inside, 4 pounds. 5, 6, 7, ramp it up, 8, and hold. So you're about 80% of your max capacity here. Hand is tight, core is tight, your leg is driving down. Take another deep breath. Maintain that tension. Maintain, maintain. 3, 2, 1. Slowly now you're going to try and pull your foot up off the floor. Don't move this hip. You're not rolling away from it, you're just making this all work. You should start to feel this flexing, get that working, hold, hold, get that foot up off the floor, get up off the floor. It shouldn't actually lift, I'm just encouraging you, right? Pretend you're trying to hit something here. Don't move this leg. Take a breath. Now you're going to slowly drive this hip down. So you're trying to get your butt cheek to the floor. Slowly relax. Take a breath. You might feel some cramping here. This is where you should feel this leg working mainly. You should feel some tension in that C shape here. Nice easy breath. Okay, so that was 2 rounds. You're gonna start with that, but as you do this more and more, I want you to get comfortable with 3 rounds, okay? So to come out of this, what you're gonna do is slowly slide that leg forward. You're going to keep this knee pinned down. You're going to open, 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 open. Drive that knee open. Here, pull open, 3, 2, 1. Close that down. Here, keep your hip where it's at, and then you're gonna drive that knee to the floor. It might not make it there unless you roll over, but I don't want you to roll over. I want you to just pull it down. 3, 2, 1, and then you're gonna open. Breathe, sit up tall. You're gonna pull open. Drive those knees apart. You should feel a good stretch on the inside of the hips here. Drive those knees apart. Drive them apart. 3, 2, 1. Slowly pull that down. Keep the hips down. You're not allowing your hips to roll over like this. You're going to keep that down. You should feel that tension in the same spot here. We're working on the internal rotation. You're going to pull down. Your knees should not go to the floor. We're working more on that. Hold. Take a breath. Pull that down. Pull that down. 3, 2, 1. And slowly relax. We're going to do 1 more. So you're going to drive that open. One thing you should not feel through this is knee pain, okay? So if you start to get knee pain, I want you to decrease the intensity at which you're working. You're still pulling that open, drive those knees apart. Deep breath, 3, 2, 1. Last one, you're gonna pull this down, keep your hip right where it's at, don't roll that hip forward, keep it pulled back. You're gonna internally rotate that knee. Take a breath, hold, drive that knee to the floor. Drive that knee to the floor. 3, 2, 1. Now to transition, right? Because you have to do the other leg. You're going to pull open, drive the knees apart, keep the knees pushed apart like you have opposite magnets here. As soon as this knee hits the ground, then this knee can transition over. And now you're on the other side, and you're going to do this leg, the same sequence. So rewind the video, watch it again.